time for our weekly Bronson Health Chat. Dr. Chris Unterseher is with us, and, it is almost time for thinking about those New Year's resolutions. Doc, how are you? And, what should people be thinking about when you're talking about health and New Year's?
I'm doing well, thank you.
Yeah.
Certainly, it's good to alter the diet, try to be more healthy. But certainly, most people recognize to some degree what that means. But certainly, decreasing fats, to some degree, decreasing carbohydrates as well. Certainly, getting some regular exercise in the routine is important also. Certainly, decreasing nicotine use, certainly with the ultimate goal of stopping entirely, is good.
Yeah.
And just in some way helping to reduce stress on a daily basis as well.
What do you say to be able to do that? I mean, life right now seems to be, for a lot of people, incredibly stressful. Is there anything that you could think of off the top of your head that will help reduce that?
Certainly, I guess nothing necessarily universally applicable there, but certainly, people, usually have something that they enjoy. As long as they can take part in that on a regular basis, something that they enjoy, that is safe for them, safe for others. It'd be good to take part in regularly because that certainly helps to boost, mood to a fair degree.
You mentioned exercise too. How much exercise are we talking about?
What we generally recommend is, 30 minutes of a kind of moderate exercise a day, 5 days a week, a total of 150 minutes of moderate exercise a week, or if you have to confine it to smaller periods of time, maybe a total of 75 minutes of vigorous exercise. Sometimes combinations of that work as well.
So is it even worthwhile to maybe do a portion of that in the morning, portion of that in the afternoon, and try to do that?
Absolutely. They have shown that for people who have a hard time kind of getting it all done at once, kind of 10-minute intervals, you can certainly be quite helpful.
All right. So when we talk about New Year's and resolutions, let's be honest. Sometimes you set them and then by mid-January you forget them. How can you go about, trying to follow through on some of these goals?
Well, a lot of times we set larger goals for ourselves than we should.
Be realistic? Okay.
Exactly. Realistic expectations is a big thing in life in general, but certainly kind of doing things stepwise, kind of starting small. I'd mentioned the 30 minutes of exercise 5 days a week. I mean, maybe starting with that 10 minutes, and kind of working your way up from there, or starting to make small dietary changes, that kind of thing, can certainly make it easier to fulfill those goals. And certainly when people get discouraged from not achieving them soon, they're easy to get pushed aside. So having smaller successes along the way can certainly help those bigger goals to get achieved.
Is that part of being realistic too? It's like, hey, look, just because you exercise for 2 weeks doesn't mean you're going to lose 10 pounds.
That is absolutely right, certainly. And generally speaking, for good weight loss or for sustained weight loss, it's a gradual process. It is something that generally speaking, like maybe over 6 months, 5% weight loss, to be expected. So not huge quantities there, but something that you can sustain. Some exercise, dietary changes that, aren't such a drastic change in your life that it's hard to keep up with, hard to doing.
Those drastic changes turn out to be most of the time unsustainable. Sounds great short term, but long term it's just not going to work.
Exactly.
All right. So, minus that, if we're looking at some of those common health-related resolutions people make every year, are there any other changes people can be doing to get and stay more healthy?
It's certainly good to establish care with a primary care provider, physician, nurse practitioner, PA. Certainly being able to see somebody on a regular basis. Certainly there are a number of things that we can do to help prevent problems, not only treat problems. Certainly what we had just talked about, lifestyle-wise can make a huge difference. But there are a number of labs and such that are worth doing, at least once every few years so that we can catch things again before they've snowballed into something bigger and harder to get control of.
It's kind of like that car where, a $5 or $10 fix turns into hundreds or even sometimes thousands of dollars if you let it go.
Exactly.
All right. So if listeners want more information or they want to have some advice, better health, what can Bronson end up doing?
Certainly, they can schedule an appointment with one of our primary care providers. We have a website, bronsonhealth.com/primary care, and people can find a provider for them.
All right, Dr. Chris, it's always good talking to you, and thanks. Have a great Christmas, and let's stick to the New Year's resolutions, man.
Yeah, absolutely.
All right, sounds great. You bet. It's Kalamazoo's Morning News. It's 590 WKZO.